Money FM 89.3. Best of breakfast. Morning Shot.
Welcome to Morning Shot. Psychologists in Singapore will soon be required to register in order to practice. Now, this is all part of the government's ongoing efforts to strengthen mental health care services and ensure patient safety.
That is correct. Currently, there is no official registry, and the move comes amid a growing emphasis on mental health and the increasing presence of psychologists beyond traditional clinical settings. For more insights, we're joined by Dr. Shawn Ee, clinical psychologist and psychoanalytic psychotherapist and director at the Psychology practice. Good morning, Shawn.
Morning, Emaad and Audrey.
Yeah, morning. Let's take a step back here. Can you give us an idea of what a psychologist does versus what a psychiatrist does?
Well, this is a very common question. Someone like ourselves, like psychologists, we typically hold a postgraduate coursework or at least a master's in a PhD or Doctor of Psychology in a specialized area of psychology, say academia, educational, clinical, or organizational psychology. And so how we treat people is broadly referring to treatment, right? So we specialize in therapy, counseling, psychological testing to help people with mental health issues. So most of the time we use talk therapy and non-medical interventions to treat mental health conditions. Specifically, the difference, right, is that we cannot prescribe medication.
All right. So, Shawn, as a clinical psychologist, when someone comes in for a session to see you, what does that process usually look like? How do you go about assessing and understanding what they need?
So assessment is typically the first phase of treatment, right? And usually involves building a shared understanding of the immediate issues or concerns of clients, families, or the context itself, which includes comprehensive history taking of family background, relationships, attitudes, coping strategies, for example. So it usually takes about 2 to 3 sessions to build a good understanding of the presenting complaints or concerns. And it allows both client and therapist an opportunity to get a feel of whether they can work with each other. So as the complexity increases, our assessment is more of an ongoing and iterative process where we would refine our understanding over time.
You got to build trust over time, I suppose. Now, we do understand that the health ministry has identified concerns about client safety. This as more psychologists practice in the private and community sectors. What's the situation like right now? And have you also heard feedback from some of your patients who had visited other places prior to going to you?
So look, the situation right now is fully saturated with many individuals who say they have the skills to treat or help people with a long list of concerns, and sometimes with minimal or no training in the relevant clinical areas. And there are many self-proclaimed therapists or life coaches, professional psychologists who tout to have the skills but actually fail to realize the dangers they pose to the community. We spent years training and being closely supervised to be able to flesh out the clinical issues in what we call an evidence-based way and target our interventions with surgical precision. So to answer your latter question, our team of psychologists at where we are have heard many stories of clients who had spent some years and valuable resources investing in ineffective therapy to ultimately find their way to us, either because they recommended or decided to try therapy again for some reason. It can compose from parenting to individual trauma work to couples therapy even. Yeah.
Okay, so this brings up a really important issue. I think you brought up some of the risks involved. So what happens if someone who is suffering from a mental health condition seeks help from someone who isn't properly trained? Could it actually make their condition worse?
Absolutely, Audrey. So firstly, I think we need to start from the beginning. So not many people can do our job, and many who deem to be unsuitable to be a psychologist are actually not permitted entry into postgraduate education at uni. So a couple of things that come to mind. So, for example, misdiagnosis, incorrect treatment, individuals who are not trained may misinterpret symptoms and provide the wrong advice. Things like delayed proper treatment, a waste of time, money, and emotional effort on ineffective help, and actually destroys the relationship with help itself. Emotional harm and gaslighting is something. So, if, for example, someone is invalidated or provided harmful advice, the person actually feels unheard or blamed for their condition. Say, for example, just think positively, or you're making excuses, can worsen their mental state. So
Toxic
it can actually
positivity.
be quite sort of like, yeah, that's right. So there's some things, this is a passionate area for all of us, actually. So, for example, someone who has a practitioner who has a rigid focus on treating someone's OCD symptoms, for example, but being unaware about the underlying trauma symptoms, for example, that was driving the symptoms itself that we can see, and miss the mark. Yeah, so these are a couple of examples, but, the main ones, if you think about it quite straight up, would be, not following strict ethical guidelines, violating privacy, personal bias versus professional ethics. Yeah, as a starting point.
Okay, Shawn, so then when it comes to regulation, are there any specific areas you feel need to be considered when it comes to vetting those who register? Is there some kind of gold standard or use case overseas that perhaps Singapore can consider adopting?
Certainly. Actually, aligning with our other colleagues in, for example, Australia, where I was trained, psychologist is actually a protected title. And we are all registered according to our area of expertise, for example, clinical, forensic, educational. Another thing is that we have to sit a national licensing exam to actually assess our knowledge, ethics, and competency. Thinking further back, actually, before we were entered into uni, we actually have to do a criminal background and character check. So things like police or Interpol clearance, working with children's check, all quite important. And lastly, I think something that we already do here, which should be continuing professional development. So we continue getting trained so we can stay updated.
It sounds like a pretty big undertaking, though. So how difficult will it be to make sure that every practicing psychologist is eventually and officially registered here in Singapore?
So as a psychologist, I personally think that with the right regulatory framework and enforcement mechanisms, it would certainly be feasible. A couple of things that would help us all get registered, thinking back, is that, we know that SPS, so the Singapore Psychological Society, runs a voluntary register currently, but implementing a legal requirement for all practicing psychs to be registered under a regulatory body is a start. So I think we have to clearly define who qualifies to use the title psychologist and set a minimum sort of educational or training standard. So, for example, a lot of us might come from different countries, get training, and we study overseas. Coming back to Singapore, we will require some accreditation from recognized universities and ensure that everybody is supervised according to what's required for registration. Say, for example, 1,000 hours, things like that. We also need sort of like enforcement or compliance penalties, for example, or unregistered practice or public awareness campaigns might also help. So I think this is only possible with government support and collaboration with the SPS and healthcare institutions. And I think last but not least, right, say, for example, the more older or sort of like practitioners that have been practicing out here for a long time already, maybe some transition period for existing practitioners and steps to ensure full registration might be useful.
Shawn, is there also perhaps a need for regulation for those who provide counseling services as well? How do they differ from what a psychologist does?
Oh, yeah, okay. So I believe that the issue about protecting the helping profession itself, including our colleagues, the counselors, and clients' safety or well-being applies to all services that come in contact with vulnerable individuals. So I would say these might be children, adolescents, the neurodiverse, or abused or traumatized people. So part of this is about the trust that is automatically bestowed upon us, the professional, that are competent and ethical in our practice. It also says that we prioritize accountability, clinical supervision, and can make clinical decisions in the client's best interests. We have a lot of, very good counterparts that we also think that would benefit from regulation. So, I would leave this with a lot of our listeners, right? So how would you feel if you had inadvertently risked your child's life by allowing an unlicensed surgeon to operate on your child?
Oh my gosh.
This is how we see it.
Right. Yeah, that is probably the only way that one can see it. Final question, Shawn. The most immediate consequence of potentially embarking on this move is what I see is perhaps a reduction in the supply of accredited psychologists and, an increase in the demand for these services. So do you see an increasing balance as a result between those that need help and those that offer help?
Good question. I actually think that, this is something that might need to be done for not just protecting the needs of the public, the community, but also, strengthening our profession. Because I think with all these potential individuals that practice unethically, it reduces the credibility of our profession. So we have to start somewhere, to be honest.
Yeah, so counselor versus life coach versus psychologist versus psychiatrist. Important distinctions made clear today. And this move towards the regulation of psychologists is a big step for mental health care in Singapore. And we'll definitely be keeping an eye on how all of this unfolds. Shawn, thanks so much for breaking it all down for us and for joining us this morning.
Well, thanks for having me. Appreciate it.
Yep, have a good week ahead. That was Dr. Shawn Ee, clinical psychologist and psychoanalytic psychotherapist and director at the Psychology Practice. Stay ahead with Money FM 89.3.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.